Essentials of Pharmacology for Health Professions, Ninth Edition. Chapter 17, Respiratory System Drugs and Antihistamines. Please keep in mind this is a summary of the chapter, and you can enhance your knowledge with further information in the ebook or a textbook. Chapter Objectives. When this chapter is completed, you should be able to describe the uses of and precautions necessary with oxygen therapy, list the medications used as smoking cessation aids and precautions for their use, list the uses, side effects, and precautions or contraindications for bronchodilators and antitussives, define uses, precautions, and differences of anticholinergics, short-acting beta agonists or SABAs, long-acting beta agonists or LABAs, and combination products. Explain appropriate patient education for those receiving respiratory system drugs. Describe the action, uses, side effects, and contraindications of the antihistamines and decongestants. And describe the limitations for use and safety concerns associated with combination cough, cold, allergy products. Respiratory diseases and disorders. Lung disease is the third leading cause of death in the United States, according to the American Lung Association. These respiratory diseases can range from mild and self-limiting, which is the common cold, to life-threatening, which would be bacterial pneumonia, pulmonary embolism, and lung cancer. Chronic obstructive pulmonary disease, or COPD, encompasses a group of progressive lung diseases. It worsens with time. It has systemic manifestations, including muscle wasting. Cigarette smoking has been known to be the primary cause, or less often caused by long-term exposure to lung pollutants. Some of the progressive diseases include chronic bronchitis, which is inflammation of the bronchial tubes, and that leads to chronic mucus production and wet cough, and emphysema, which is destruction of the tiny air sacs at the base of the lungs, diminishing the capacity and efficiency of lungs to utilize oxygen, and this leads to shortness of breath and exercise intolerance. Some therapeutic measures for respiratory distress includes oxygen therapy, bronchodilators, mucolytics, respiratory stimulants, corticosteroids, expectorants, antitussives, and smoking cessation. Oxygen therapy is therapeutically used when there is insufficient oxygen supplied to the tissues, known as hypoxia, and to decrease the workload of the heart and respiratory system, especially during distress. Oxygen can be administered by endotracheal intubation, nasal cannula, various masks, tents, or hoods. Some conditions in which oxygen therapy is indicated include heart and lung disease such as COPD, smoke inhalation, carbon monoxide or cyanide poisoning, some CNS conditions with respiratory difficulty or failure, and there are some precautions, and they include patients with COPD as high O2 concentration may cause hypoventilation or apnea. You never use oxygen near fire or around cleaning aerosols or electrical equipment that may spark. Knowledge Check Activity 17.1, which is a therapeutic reason to administer oxygen to a patient. Choose from the following, write your answer down, and you can check it at the end of the video. Respiratory stimulants include caffeine citrate in the treatment of neonatal apnea of prematurity, and theophylline administered IV or orally to stimulate respiration in infants. Bronchodilators are good therapeutic measures to use because they act by relaxing the smooth muscles of the bronchial tree, thereby relieving bronchospasms and decreasing the work of breathing. They are used in the symptomatic treatment of acute respiratory conditions for those asthmatic patients, as well as many forms of COPD. They can be given orally, parenterally, and by inhalation. They are classed in three different classes: sympathomimetics, or adrenergics, anticholinergics, or parasympatholytics, and xanthine derivatives. The inhalation route of administration is preferred to minimize adverse systemic effects. These forms of inhalation include metered dose inhalers, dry powder inhalers, and small volume nebulizers. The metered dose inhalers are popular because of their ease of use, efficacy, and portability. You definitely want to make sure we tell our patients to clean them in between the medications to avoid buildup of that medicine at the mouthpiece, because that could inhibit drug delivery. They need to be cleaned at least once per week. The dry powder inhalers provide the medication only under pressure of spontaneous inspiration rather than through compression of a valve. So the patient must be able to generate sufficient inspiratory effort on their own to deliver the medication. So that device should not be used in acute respiratory distress. The small volume nebulizers, or SVNs, now these work by creating an aerosol mist of a drug solution that can be inhaled into the lungs through a mouthpiece or a mask. One of the classifications of bronchodilators is the sympathomimetics, or adrenergics. These are potent bronchodilators that increase vital capacity and decrease airway resistance. They work on the smooth muscle in the lungs to cause relaxation. There are several side effects listed: nausea, vomiting, decreased appetite, cough, sore throat, hoarseness, cardiac irregularities, hypertension, hyperglycemia, and hypokalemia. Cautions and contraindications include: first, administration should be observed by a medical professional. Contact physician if decreased effectiveness occurs. In patients with cardiovascular or kidney disorders, diabetes, seizure disorders, or hyperthyroidism should be monitored. Listed are several examples of these adrenergic medications. There are two classifications in the adrenergics that we want to be aware of, and these are your SABAs, which are short-acting beta adrenergics, and your LABAs, which are long-acting beta adrenergics. Your short-acting, an example of this one is albuterol. This is the drug of choice, and these are used for managing acute exacerbations of asthma. These are also used as a rescue method of treatment. Treatment for stable COPD, where symptoms come and go, and assist in relieving symptoms. Precautions with the SABAs: they're not indicated for patients with unstable cardiac status history, heart attacks, glaucoma, drug sensitivity, or prostatic hypertrophy. The long-acting beta adrenergics, an example of this is salmeterol. These are used for prophylactic treatment, long-term help prevent and treat COPD when long-term symptoms are continually present. They're also used for prophylactic treatment, as I mentioned, and long-term maintenance meds. Precautions with these: they're not indicated for patients with unstable cardiac status history, heart attacks, glaucoma, drug sensitivity, or prostatic hypertrophy. They should never be used to treat an acute asthma attack or bronchospasm, and should be used only for asthma prophylaxis in combination with an inhaled corticosteroid. The anticholinergics, or parasympatholytics, is another class of the bronchodilators, and these achieve bronchodilation by decreasing the chemical that promotes bronchospasms. Anticholinergics block the parasympathetic nervous system and can cause drying of pulmonary secretions. Side effects listed for these are cardiac effects, changes in heart rate and palpitations, headache, drowsiness, dizziness, confusion, agitation, thickened secretions, constipation, and abdominal pain. There are a few cautions and contraindications. They are not intended for patients with unstable cardiac status, history of heart attacks, glaucoma, drug sensitivity, or prostatic hypertrophy. And there are those examples of these type of medications, the anticholinergics. The last classification of the bronchodilators are the xanthines. Theophylline is one of these, and it relaxes the smooth muscle of the bronchial airways and pulmonary blood vessels and may possess anti-inflammatory actions. They're usually reserved for patients with COPD who do not respond to or cannot take inhaled long-acting bronchodilators. They're usually administered as sustained-release formulations with other respiratory system drugs such as your adrenergics and anticholinergics for additive effects on symptom relief and breathing functions. The side effects for these are GI distress, CN stimulation, cardiac irregularities, and hyperglycemia. Cautions, contraindications for these are cardiovascular, kidney, pulmonary, or liver dysfunction, diabetes, peptic ulcer or glaucoma. Children and older adults are more prone to toxicity. Pregnancy, lactation, and IV injection must be done slowly. Example of this medication is the theophylline. Knowledge check activity 17.2. Which bronchodilator assists in relaxing the smooth muscle of the bronchial airways and pulmonary blood vessels? Mark all that apply. Choose your answer, write it down, and you can check it at the end of the video. Knowledge check 17.3. Which treatment plan does LABAs work more effectively? Choose from the following choices. Write your answer down and you can check it at the end of the video. Case study activity. A 9-year-old diagnosed with asthma is having difficulty in using the inhaler and is wasting most of the dose due to improper technique. The physician observes the child's technique and prescribes a blank to assist the child with administration of their inhaler. Look at the following choices, choose one of these, and you can check your answer on the next slide. If you chose answer D, a spacer device, that is correct. Sometimes spacers are needed to ensure drug delivery within the lungs, especially for adolescent patients. This slide provides valuable information on patient education for bronchodilators. Please remember to read all patient educations at the end of each section, as it provides important information to instruct your patients on how to properly take their medications. Corticosteroids. Synthetic corticosteroids are used to relieve inflammation, reduce swelling, decrease bronchial hyperresponsiveness to triggers, and suppress symptoms in acute and chronic reactive airway disease, asthma, and some COPDs. Corticosteroids should be administered systemically. Oral and injectable forms are provided for short-term bursts during exacerbations and occasionally at the beginning of treatment until symptoms are controlled. Effective delivery methods of synthetic corticosteroids orally include inhaled and intranasal. I will discuss these further on the next couple of slides. The inhaled corticosteroids are considered a preferred drug therapy in long-term prophylactic management of persistent asthma of various severities. The regular long-term treatment reduces exacerbations, improves control of symptoms and lung function, and reduces hospital admissions and deaths from asthma. Side effects with these are the inhaled corticosteroids include fewer side effects than oral or injectable administration routes, oral thrush, irritation of the esophageal passage. Cautions and contraindications include proper patient education to avoid mouth and esophageal irritation. And then you have your examples of the inhaled medications listed. The nasal corticosteroids are increasingly considered first-line therapy for most non-infectious types of rhinitis and reduce congestion, edema, and inflammation. You want to start these before symptoms occur and usually take them regularly throughout the period of exposure. Side effects with these are throat irritation, dry mouth, hoarseness, oral fungal infections. The patient should be encouraged to rinse mouth with mouthwash or water after administration, and increased susceptibility to pneumonia. Cautions and contraindications include viral, bacterial, or fungal infections, hypertension or congestive heart failure, diabetes, hypothyroidism or cirrhosis, and renal failure. Example of those medications with the nasal corticosteroids are listed here. Asthma prophylaxis medications include leukotriene receptor antagonists and mast cell stabilizers. The leukotriene receptor antagonists, such as acalate and singulair, are oral antagonists for asthma prophylaxis, also used to prevent exercise-induced bronchoconstriction and treating chronic asthma. They help to control the inflammatory process of asthma caused by the leukotriene production, thus helping to prevent asthma symptoms and acute attacks. They can be used as monotherapy or as add-on therapy in patients whose persistent mild to moderate asthma is inadequately controlled with inhaled corticosteroids. Side effects of these include headache, dizziness, nausea or dyspepsia, pain, fatigue, respiratory infections and fever, behavior or mood changes, sleep disturbances, and suicidal ideation. Contraindications are hepatotoxicity, pregnancy or lactation, treatment of acute episodes of asthma. These are not rescue medications. Interactions include aspirin, erythromycin and theophylline, warfarin and zerfalucast, and phenobarbital and rifampin. Mast cell stabilizers. The rupture or degranulation of mast cells and the subsequent spilling of their chemical mediator contents cause an inflammatory response that can lead to asthma. Stabilizing the mast cell membrane has anti-inflammatory actions that modify the release of mediators from mast cells and eosinophils. One of the first classified mast cell stabilizers is cromolyn. Cromolyn is a prophylactic for asthma. There's no value in the treatment of acute attacks of asthma with cromolyn, and it has been used in the prevention of exercise-induced bronchospasm. Side effects include throat irritation, cough, bronchospasm, nose burning, stinging, and sneezing. And contraindications include those with cardiovascular disorders. Interactions, there are no major drug interactions. This slide provides valuable patient education on how to instruct patients being treated with inhaled corticosteroids and asthma prophylaxis agents. Mucolytics and expectorants. Mucolytics are important because they decrease the hypersecretion of and liquefy pulmonary secretions. Thick secretions are often a problem in patients with obstructive lung disease. There's little evidence that inhaled acetylcysteine is more effective than adequate hydration for thinning or increasing the clearance of secretions. Some contraindications include asthma or a history of bronchospasm, respiratory insufficiency, inadequate cough mechanism, or gag reflex, depression as liquefied pulmonary secretions occlude the airway if the patient is unable to adequately clear the secretions. Expectorants increase secretions, reduce viscosity, and help to expel sputum, but like mucolytics, offer little clinical benefit for patients with obstructive lung disease. Adequate fluid intake is important to maintain normal fluid volume, but excessive fluid intake is of no value. There are a few side effects with expectorants, and they include nausea, vomiting, diarrhea, drowsiness, dizziness, and headache. Some contraindications include persistent or chronic cough, some asthmatics prone to bronchospasm, cardiovascular disease and hypertension, diabetes, glaucoma, hyperthyroidism, and prostatic hypertrophy, especially with combination products in pregnancy or lactation. Coughing, which is a reflex mechanism that helps to eliminate secretions from the respiratory tract, are usually treated with antitussives. These help to prevent coughing in patients not producing a productive cough. Some of the cough suppressants are divided into narcotic preparations, your codeine and your hydrocodone, and then you have your non-narcotic preparations such as dextromethorphan. Along with the codeine, the narcotic antitussives, there's a black box warning. The FDA issues these black box warnings for certain medications that have the potential for serious safety risk. That's the FDA for these black box warnings. Usually they communicate potential rare but dangerous side effects, injury, and death, and they may also serve to communicate important instructions for safe use of the drug. This is found in your clinical application under antitussives. Side effects of antitussives will include respiratory depression, constipation, urinary retention, sedation, dizziness, nausea, and vomiting. Our cautions or contraindications for antitussives, we're looking at addiction-prone patients, asthma, COPD, CNS depressants. And there are your examples of these antitussive medications. Antihistamines are used to treat the symptoms of allergies such as rhinitis, conjunctivitis, and rash. However, when they're used to reduce nasal secretions in the common cold, the consequent thickening of bronchial secretions may result in further airway obstruction, especially in those patients with COPD and asthma. There are two categories of H1 blockers, which are your first generation and second generation antihistamines. Actions of antihistamines is they are competitively antagonizing the histamine 1 receptor sites. The antihistamines combat the increased capillary permeability and edema, inflammation, and itch caused by sudden histamine release. Your side effects for first generation antihistamines are drying of secretions, especially the eyes, ears, nose, and throat, sedation, dizziness, tachycardia, and hypertension, insomnia, tremors, especially in children, muscular weakness, visual disorders, and cognitive impairments. For your second generation, which are usually mild side effects, include headache, dizziness, fatigue, and drowsiness, dry mouth, and pharyngitis. Cautions or contraindications for the first generation antihistamines include COPD and asthma, operating machinery or driving a car, closed angle glaucoma, cardiovascular disorders, benign prostatic hyperplasia, pregnancy and lactation, and seizure disorders. For your second generation, they include asthma, renal and hepatic impairment, driving or operating machinery, pregnancy or lactation, and children less than 2 years old. Several adrenergic drugs, such as neosynephrine and Sudafed, act as decongestants. How do decongestants work? They constrict blood vessels in the respiratory tract, resulting in the shrinkage of swollen mucous membranes and help to open nasal airway passages. Usually they are combined with antihistamines, analgesics, caffeine, and or antitussives. A lot of these are available over the counter, and by combining several of these drugs, the possibility of adverse side effects is increased, especially without adequate medical supervision. Side effects: anxiety, nervousness, insomnia, tremors, seizures, palpitations, tachycardia, hypertension, headache, reduced urine output, reduced cardiac output, and cerebral hemorrhage. There are some cautions or contraindications, and they include cardiovascular disorders, hyperthyroid or diabetes, older adults, especially those with glaucoma or benign prostatic hyperplasia, and pregnancy or lactation. Knowledge check 17.4. Which respiratory drug system constricts blood vessels, which results in shrinking of swollen mucous membranes? Look at the following choices, write your answer down, and you can check at the end of the video. Cough, cold, allergy use, and safety concerns. Many prescriptions and over-the-counter cough and cold formulations are available that combine several drugs to treat 2 or more simultaneous symptoms. Combination formulations should be used only if the corresponding symptom is present and each individual component is available in the proper strength and dosing interval a patient may need. It's very important that healthcare professionals thoroughly assess each patient's use of similar products products, both over-the-counter and prescription, to avoid duplication of therapy and the potential for inadvertent overdose. To ensure public safety, the FDA requires additional product labeling on non-prescriptive drugs and the new child-resistant packaging and measuring devices for their products. Due to changing statuses of cold and cough medicine, a website is available for individuals seeking information on the use of medications for children. Knowledge check 17.5, which does not represent new safety measures regarding OTC medication purchases and use. Choose from the following choices, write your answer down, and then you can check it at the end of the video. This slide provides important patient education for patients taking respiratory system drugs. Knowledge check 17.6, which are considered important patient education for patients receiving respiratory drugs. Mark all that apply. Write your answers down and you can check to see if you are right at the end of the video. Smoking cessation drugs. Cigarette smoking is the leading cause of preventable disease and death in the United States. Smoking cessation aids have been shown to help twice as many smokers quit versus quitting cold turkey when used properly. The following is a list of smoking cessation aids and their precautions. Nicotine replacement therapy, you have gums, lozenges, patches, inhalers, and nasal sprays. Precautions for use with these would be dental problems due to exacerbated gum chewing, pregnancy and lactation, unstable cardiovascular disease, and overdose due to using multiple combined therapies. The e-cigarettes, these are the battery-powered devices, and they heat liquid nicotine into inhaled vapor or vaping, which stimulates tobacco smoking. These should theoretically have fewer toxic effects because of fewer toxic chemicals than traditional cigarettes, but there's concrete evidence that's lacking. There's not been linked to any serious health effects or issues with these, but they've been widespread using these for short periods of time, so there's no basis to determine any long-term risk as of yet. Bupropion, this is an oral antidepressant drug, Wellbutrin. It's also prescribed as an aid to smoking cessation. It's marketed as Zyban with a combination of nicotine patches. Precautions for this is pregnancy, lactation, unstable cardiovascular disease, and overdose due to using multiple combined therapies. Varenicline, which is Chantix, this is a prescription-only partial nicotine receptor antagonist. It's given orally and indicated for adults as an aid in smoking cessation. It helps alleviate symptoms of nicotine craving and withdrawals through its agonist activity while inhibiting the effects of repeated nicotine exposure by its antagonist activity, thus eliminating the pleasurable feelings associated with smoking. Precautions for use would be pregnancy and lactation, unstable cardiovascular disease, overdose due to using multiple combined therapies. This picture shows a nicotine patch. These patches can be applied for up to 12 hours, then taken off overnight. Knowledge check 7. Nicotine patches may be worn for blank hours before having to be removed. Write your answer down and you may check them at the end of the video. It's time to check your answers for the knowledge check activities. This slide provides answers for 17.1 through 17.5. 17.6 and 17.7 are on the following slide. Knowledge check 17.6 and 17.7 answers. Self-assessment. Answer the following questions to assess yourself and see how well you learned from this chapter: respiratory system drugs and antihistamines. This is the conclusion of chapter 17.